Okay, first of all, Richard, we've heard a lot in the news over the last couple of days and weeks about the government's plans for the NHS. Can you tell me anything about what you think it means for health provision in general in Stockport?
I think fundamentally it will remain the same, where care of individuals will be delivered by clinicians, nurses, doctors, paramedics, etc. But there's a considerable amount of change to what you might call NHS architecture, what the organisations are that the individuals work for that deliver that care, and particularly how care services are commissioned, planned, funded by Stockport PCT, which won't exist in the future.
So what's that going to mean for the employees of the PCT? Do you think there's going to be a transfer to different organisations, or do you think there could be a situation where people are going to lose their jobs?
I think a bit of both. The current role of the Primary Care Trust is some of that is going to transfer to the new National Commissioning Board, possibly through a regional division. Some's going to transfer to a GP commissioning consortium in Stockport. Don't quite know what shape or form that would take. But overall the government understandably want to save funds from this, so something above 30-40%, and I think the figure in the documentation is 45% of staff costs are going to be tried to be saved by that, and that means actually individuals.
So I think what you're saying is it's inevitable that there could be some job losses.
I think that's true. In Stockport and across the country, we're no different from the rest of the country. There will be some job losses through reduced functions of what currently done by primary care trusts.
Now, we've looked at doctors taking a bigger role in how services are provided and how they're commissioned and who actually provides them. And I think on the rationale, or the government's rationale, that they know the patient best. Do you think that's going to lead to a better standard of healthcare for people in Stockport?
I think it could do. That's my frank and honest assessment. Trying to align the financial responsibility to the clinical responsibility seems to me a really good idea, so individual doctors know the financial consequences of the clinical decisions they make. But our local GPs, and again this is true across the country, are not as familiar as perhaps they should be with all elements of the services, elements in the health and social care and the well-being territory. They're very familiar with acute conditions and people with medical conditions. Are they as familiar with other services? I'm not absolutely sure on that.
Because we hear lots, don't we, about GPs and how busy they are and how much they've got to do already. When you look at what they're going to be taking on in terms of management and managing a budget and finances and everything else, have they got the capacity to do that?
I think probably not. I think what we do need is their perspective and their insight, their strategy, but not to make the GPs accountants or not to make the GPs contract managers or whatever it might be. We need their insights from their perspective, but we don't want to try and replicate the jobs that others might be able to do just as well, if not better.
Because I think it was my understanding that certainly in Stockport anyway, that there was a move towards that anyway, wasn't there? With there was already a move towards GPs providing more input into how services are actually commissioned.
Yeah, locally we've created a company called Stockport Managed Care, which hosts our practice-based commissioning, GP involvement, GP engagement processes, and that's really worked quite well. And we've tried to get the best of that, which is engagement and insight, rather than to replicate inside that company structure all the functions of the PCT.
Now, it's being reported that Stockport PCT, or NHS Stockport, needs to make savings of around £12 million this year because the budget wasn't in balance last year. Can you just tell me a bit about what's actually happening at the moment from that point of view?
Well, first of all, that's a sort of true situation. As anywhere across the NHS, there's a financial challenge, growing expectations of people, ageing population, opportunity to provide new services, all those come at costs. So we're having to make £12-13 million worth of savings and change this year. A range of measures, some recurrent in terms of savings and improvements in sort of patient care close to home. Some we're having to think about decommissioning, stopping some optional or less core services. Now those are really tough decisions, but they are the situation we find ourselves in. And in Stockport and across the NHS and across the public sector, those are the decisions we're going to have to make over the next foreseeable period.
So are you able to tell us at the moment where the people of Stockport might see a change in frontline services as a result of these savings?
No, it's very early days, Andy. We're still working through that. We would absolutely guarantee to the people of Stockport, the patients of Stockport, that we'll try to reduce backroom services, admin staff, management staff, or whatever it might be before we contemplate sort of frontline services. But I suppose ultimately there can be no absolute promise that's the case. We will try and ensure our best.
And if we think about that sort of, the fact that there is a budget deficit, which has had presumably the strength of all the resources of the PCT trying to manage that over the last 18 months. When you've got doctors trying to do that, do you not think the situation is going to get worse rather than better?
I certainly hope not. On behalf of the residents and the public of Stockport, the hope and the expectation is that the insight that the GPs and the clinicians bring to that will help them make savings that management, with the best will in the world, don't understand or can't make. I think we need to use the best of, as I said earlier, the GP insights into clinical decision making with some of the skills of PCT staff or whatever it might be about, I suppose, how the NHS architecture and system works.
So are you actually confident about healthcare provision in the NHS for the people of Stockport going forward?
I'm confident that it will be better and safer here than it will be elsewhere because of hopefully our competence over recent times, the good establishment we've got with GPs involved. We're halfway or a third of the way along that path rather than starting from nothing, and also our good working relationships with the local authority, Stockport MBC. Stockport has much to be proud of because it is one local foundation trust which is really strong clinically, one PCT and one local authority. I think working together we can make the best of this.